Good afternoon, everybody. And Sogon for inviting me to participate in this amazing webinar. I'm going to be talking about HIFU, something which is not known by many gynecologists, but hopefully will enlighten you today. If we look at the traditional treatment of fibroids over the years, most of the treatment has been invasive, which has involved a laparotomy where either a hysterectomy or a myomectomy was done. As you know, with medicine now, everything is going more towards minimally and non-invasive procedures. With the development of endoscopic procedures like laparoscopy, hysteroscopy, we came up with minimally invasive procedures to treat fibroids, including uterine artery embolization. And now we come up with a totally non-invasive procedure, which is based on ultrasound imaging, and this is HIFU. HIFU has been around for about 20 years, and it's practiced now in 26 countries around the world. To explain to you the principles of HIFU treatment, what happens is you get high-intensity ultrasound waves which are produced by a concave transducer, and because it's concave, it converges all the ultrasound waves to a point which is known as the focal point, which is about 12 centimeters from the
Raymond,
yeah.
Raymond, you have not shared your slides.
Are they not showing?
Yet now.
Okay, let's have a look.
Great.
Can you see them now?
Yes, we are seeing now. Cool.
Okay, just hang on a minute. Can we get rid of this? I've just got my IT specialist helping me here. Okay, so basically, do you want me to start from the beginning again?
On the time? Yes, you can. Yes, you can.
Okay, so what I was saying is with the development of fibroid treatment over the years, initially the treatment was invasive, which was comprised of a laparotomy, which a hysterectomy or a myomectomy was done. And then as endoscopic techniques became available, we came up with minimally invasive procedures like laparoscopy and hysteroscopy, also including uterine artery embolization. And then as ultrasound imaging progressed, we came up with a completely non-invasive procedure known as HIFU. Now, HIFU has been around for about 20 years, and it's practiced in 26 countries around the world, if you can see on the map there. Now, if you look at the principles of HIFU treatment, how does HIFU work? Well, basically what happens is we get high-intensity ultrasound waves, which are produced by a concave transducer. And these converge to a point about 12 centimeters from the transducer. And at this point, which we call the focal point, heat is produced, okay? This focal point we direct into the fibroids. And when the temperature at that focal point gets to above 56 degrees Celsius, it causes protein denaturation, which then causes coagulation, necrosis, and cell death. So the mechanism is similar to using a magnifying glass to focus the rays of the sun. I'm sure we all did this as kids. You take a magnifying glass and you hold it above a piece of paper, and at the focal point where all the waves converge, you're going to get heat, which is going to cause the paper to burn. But if you move your finger higher up in this area over here, nothing happens. And that's basically what happens with HIFU. So what are the mechanisms of tissue damage with HIFU? Well, the first one is conversion of the mechanical energy, which is the ultrasound waves, into thermal energy heat. And as we said before, this will cause immediate thermal toxicity once the temperature goes above 56 degrees Celsius. The other process by which we get tissue damage is something called inertial cavitation. And what happens is as the ultrasound wave is moving through the tissues, you get alternating cycles of compression and rarefaction. And during the rarefaction stage, gas bubbles are drawn out of the solution. And these gas bubbles will fluctuate in size, eventually getting very large, and then they collapse. And this releases energy, which causes a further increase in the temperature. So if we look at this slide here, you can see that's the path of the ultrasound wave. And here you've got your phases of compression followed by rarefaction. Okay, and then you can see what happens over here with the bubbles. They get bigger, then they get smaller, and they continue to increase in size until eventually they rupture. So what happens over here, we can see we've got the skin over here. We've got the transducer here, which will be sitting up against the skin. Here we have our acoustic pathway, okay? And then at the end over here, we've got our focal point. Now that focal point we direct into the fibroid. This is actually a uterus, doesn't look like it, but that's a uterus. And this is where we get the tissue damage occurring over here. In this area over here, there's minimal energy, so these tissues are not damaged during the process. So basically what's happening with HIFU is we selectively destroying tissue at depth without harming overlying and adjacent structures within the path of the beam. If you look at the skin after your different treatments, after laparotomy, we've got quite a scar after laparoscopy. It's less invasive. We've got a couple of little scars there. After HIFU, the skin is completely unblemished. If we look at the uterus after our different kinds of treatment, this is what the uterus will look like after either an open myomectomy or a laparoscopic myomectomy. And that's what the uterus will look like after HIFU. Now, HIFU is used to treat solid and benign and malignant solid tumors, including prostate, liver, breast, pancreas, bone, renal. But in gynecology, it's only used to treat uterine fibroids and adenomyosis. This is the machine that we've got at our department. It's made by this company here, which is called HIFU. It's HIFU with the A inside there. They invented and they manufacture these machines. And their motto is that treatment should minimize harm to patients. And this is our machine, a JC200. I'm not going to go through all the equipment. The important part that I want to show you is the transducer. So this is the treatment transducer that I talk about. You can see it's a concave piezoelectric transducer. And what it does is it converges the ultrasound waves to a focal point 12 centimeters above the surface of the transducer. And in the center of the transducer, we've got our imaging transducer. And this is how we locate the fibroids during the treatment. Now, what patients are we treating with HIFU? So the main thing that we are treating are symptomatic fibroids and also adenomyosis. So these are patients presenting with menorrhagia, and a lot of them are anemic. Patients with dysmenorrhea, infertility, and patients with poor obstetric history, obviously related to multifibroid uteruses, not due to a tubal occlusion, patients with pressure symptoms, chronic constipation, urinary symptoms, frequency nocturia. In our population group, I work at Baragwanath Hospital, we treat mostly black patients. They want to preserve their uterus. They're not keen on having hysterectomies. In fact, a lot of patients refuse all forms of surgery. So that's another indication for our patients. And also, we have a lot of patients who are Jehovah's Witness and other religious groups which refuse to have blood products. The criteria, our patient criteria, they shouldn't be obese. The abdominal wall thickness should be less than 6 centimeters. If it's above 6 centimeters, there's an increased chance of burning the skin. So 6 centimeters is our cutoff. We go up to a uterine size of about 18 weeks. Above 18 weeks, it becomes dangerous and there's more chance of getting a spinal damage and damage to bowel. We must be able to see the fibroids on ultrasound. So they should be greater than about 2 centimeters in diameter. We can't treat very small fibroids. As with any other gynae procedure, they should have a normal pap smear. If they've got an intrauterine device, it should be removed before treatment because this will deflect the ultrasound waves and cause damage to surrounding structures. They obviously shouldn't be pregnant. They should be in good general health. This procedure is done under conscious sedation. So even though they're not having a general anesthetic, they should still be of good general health. Again, another problem for us is if the patients have big scars on the abdomen in the path of the ultrasound beam. Scars, again, will absorb energy and there's an increased chance of getting burns on the skin. The procedure can take quite a long time, so the patients must be able to lie prone for at least 2 hours without moving. Once we start the procedure, they can't move because we form a plan and we treat according to the plan. If they move, we could be damaging surrounding structures. The patient must also be able to communicate with the doctor because the reason why we do this under conscious sedation is the patient needs to explain to us what they're experiencing in terms of pain or the skin getting hot, things like that. In terms of exclusion criteria, as I mentioned before, they shouldn't have an abdominal wall greater than 6 centimeters. The uterine size shouldn't be more than 18 weeks. Big abdominal wall scars. And obviously, if the patient's got multiple fibroids, 8, 9, 10 fibroids, again, we're not going to be able to treat this. It's going to take too long. This is some of the patients that we see. Obesity and very ugly scars. A patient like this would definitely develop second or third degree skin burns if we try to treat her. Which fibroids don't we treat? Obviously, we can't treat all fibroids. So what we do is we do T2 weighted MRI on all our patients. If they have got type 3 or hyperintense fibroids, which means they're very vascular, these patients, we're not going to get a good result because we rely on heat building up in the fibroid. So if the fibroid is very vascular, the heat is going to be dissipated by the increased vascularity. So they're not good candidates for HIFU. Again, if the patients have got large pedunculated fibroids with a very thin stalk, we're not keen to treat these patients. It's going to be difficult for us to get a clear acoustic pathway, which means that we might have bowel surrounding the fibroid, which we could damage. And also, if we do treat it, there's a chance that the fibroid's going to drop off into the pelvic cavity and it's not going to be resorbed. Also, fibroids in the uterine cavity. Most of our patients are desiring fertility, so we don't want to treat fibroids in the cavity because there's a very good chance we're going to land up damaging the endometrial lining. So just very briefly, the procedure. So what happens is the patient lies prone and we place the patient in such a way that the pelvis, the uterus, is lying over the transducer. There's the transducer there. So the uterus is lying over the transducer. The patients are then given conscious sedation. We have anesthetists to administer the sedation for us. We then use the imaging transducer that's situated in the center of the treatment transducer to find the fibroids. And then we direct the focal point into those fibroids. And then we start depositing energy into the fibroids. And we do this until we get what we call grayscale change. What happens with grayscale changes, as you get coagulation necrosis, the tissue starts becoming white in color. So that's what happens as you deposit energy and you move the transducer around inside the fibroid. you get this white appearance. And we continue doing that until the whole fibroid becomes white. And then we know we've ablated the entire fibroid. And how do we monitor the treatment? So we use a grayscale change. You can see over here, this fibroid is almost completely coagulated, ablated. We don't go right up to the edge of the fibroid because heat dissipates. So we normally leave about 1 centimeter all the way around to prevent damage to surrounding structures. So we monitor, the main way we monitor the progress is on the grayscale change. We also use our color Doppler. So we would put the Doppler on before we start treatment, and then we put the Doppler again when we think we've completed the treatment, and we'll look for blood flow. What they use overseas, we don't have it in South Africa because it's quite expensive. It's microbubbles, a substance called Sonoview. These are tiny little bubbles that have got contrast in them. You inject them before you start the treatment, and you'll see the fibroid lights up like a Christmas tree. When you think you've completed your treatment, you will inject it again, and then you should be able to see that you've ablated the blood supply in your fibroid, which means that you've treated the fibroid. So there's the fibroid before treatment. Takes up a lot of contrast. There it is post-treatment. So as with all procedures, there's complications. So the main one is pain. And that's why the patients are under conscious sedation. They need to tell us where they are experiencing the pain. Now, this pain is usually transient. It's very short-lived and it's mild. So while we're treating, the patient will tell us that they've got treatment, low abdominal pain. Now, that is normal because we're creating ischemia in the fibroid. So they'll tell us they're getting pain in the abdomen. Again, pain in the back and the buttocks is normal. We're not worried about that. If they complain of pain in the legs, that's dangerous because we can land up, if we continue treating them, we'll land up with nerve damage, permanent nerve damage and a foot drop. So the patients, that's why they're awake. They tell us exactly where the pain is and we know how to manage it thereafter. Skin toxicity is another problem. So the patients can tell you that they're feeling increased heat on the skin. If they were asleep and they weren't able to tell us that the skin's getting hot, we would land up with skin burns. But because they're awake, they'll tell us the skin is getting hot, and then we'll take certain maneuvers. If you've got bowel in front of the uterus, you need to make sure that you get it out of the way. We have certain maneuvers to get bowel out of the way. We can't go through bowel. Anything that's got air in it is a problem. Ultrasound waves don't like air. So if you've got bowel in the way and that's got gas in it, you'll land up perforating the bowel. Bladder injury, again, if you've got air bubbles in the bladder. So we use the bladder to maneuver the uterus. So we continually adding fluid and draining fluid out of the bladder to adjust the uterus. If you get air bubbles into the bladder, again, you can get damage to the bladder. You can end up with a VVF. And as I mentioned before, endometrial damage, if you come too close to the endometrial lining with an Asherman syndrome, and as we said, nerve injury. So what are the advantages of HIFU? Well, it's a day procedure. In places like China, the patients will come in the morning, have the procedure, go home the same day. At our hospital, due to patients not having transport and that kind of thing, we normally keep them overnight. The procedure is completely non-invasive, so we have uterine sparing. There's never the possibility that you're going to have to do a hysterectomy on the patient. And because we have precise ablation to the target area, we don't damage normal uterine tissue. So if the patients do conceive, they can have a normal vaginal delivery thereafter. There's no general anesthetic, so the patients don't wake up much quicker and they feel better. Faster recovery period. The patients return to work within days. It's in South Africa, if a patient has a laparotomy, they're entitled to up to 6 weeks off from work. With the HIFU, they're back at work within 1 week. Another thing is there's no ionizing radiation at all, so the procedure can be repeated multiple times. So if we've got, say, a patient with 7 or 8 fibroids, we may treat 3 or 4 at one sitting and then bring them back in 3 to 6 months' time and treat the remaining fibroids. Or if it was a very big fibroid and we couldn't treat the whole thing adequately at the first sitting, we can repeat the treatment again. And because it's so targeted, the treatment, we have no damage to the ovaries. It's cost effective, decreased hospital stay. Again, there's no necessity for blood transfusions. There's no bleeding during this procedure. So there's no blood transfusions, which are costly and a precious commodity. In South Africa, we have a big HIV problem. So there's no worry about HIV transmission to healthcare workers. If you look at the comparison of recovery times with the ultrasound guided HIFU, it's 1 to 2 days. With a hysterectomy or a myomectomy, as I said, we give the patients 4 to 6 weeks. With laparoscopy, 2 to 3 weeks. And with uterine artery embolization, 1 to 2 weeks. So as with all procedures, there's disadvantages and limitations. As I mentioned before, the acoustic pathway cannot penetrate anything with air. So we can't treat anything in the lungs, and if bowel is sitting in front of the uterus, we won't be able to treat it. We need to move that bowel out of the way. Again, we've got limited accessibility because the focal length is only 12 centimeters. If you've got a patient who's got a very thick abdominal wall and she's got a posterior fibroid, you might find that to get to the fibroid, it's over 14 centimeters. So we won't be able to treat that fibroid. Another problem is if the fibroid is too close to adjacent structures and we can't leave an adequate area around to take care of the dissipation of heat, we might not be able to treat that patient. As I said, it's a lengthy procedure. To treat a 6 centimeter fibroid can take us about an hour and a half. So if you're treating 3 or 4 fibroids, it can take us 3 to 4 hours. And also, fibroids that are too small, less than 2 centimeters, are not visible and then may then come up as query recurrence of the fibroid. Factors affecting recurrence of fibroids. If the fibroid is greater than 6 centimeters in diameter, there's a good chance that this fibroid might not be treated adequately. Then it might recur. Again, if they're very vascular, it makes the treatment difficult. When we treat the fibroid, we need to get more than 60% ablation of that fibroid. So if you've got less than 60%, we call it the non-perfused volume, then there's a chance that this fibroid can recur. And also, posterior wall location in a big patient is also going to be more difficult to treat. Just want to share with you some of our results from South Africa. To date, we've treated 460 patients. All the patients have been Black patients. Average age the mean age is 31. The mean weight 79 kilograms, and the mean abdominal wall thickness of 49 millimeters. Most of the fibroids have been anterior, intramural, and on MRI T2 signal intensity, the majority have been hyperintense or with minimal vascularity. Symptoms that our patients present with: dysmenorrhea 73%, menorrhagia 71%, anemia. We have a large number of patients that come in with HBs below 12, 68%. Infertility is a big issue in our patients. Chronic constipation, frequency of urination. Now, adverse events during the actual treatment. Most of the patients will complain of low abdominal pain, and this is expected because we're causing ischemia in the fibroid. Ischemia in any tissue will give you pain. Again, if the fibroids are in the posterior location, they might complain of sciatic and buttock pain. We've had 51% of our patients complaining of that. Burning sensation on the skin in 31%. and also transient leg pain in 14%. Now, the major adverse events that we've had to date in our 460 patients, we've only had two cases of first-degree skin burns, which healed spontaneously. They didn't require any intervention, and they were healed within about 2 weeks. We've had no bowel injuries or bladder injuries. We've had 2 cases of nerve injury with spontaneous resolution also within about 6 months. If all our patients fill in a quality of life score. So we fill it in pre-treatment, and then we see them at 1 month, 3 months, 6 months, 12 months, at 21 months. And if you look at the quality of life of these patients, if you look before treatment, they had a low score of about 35, which steadily increased after treatment. At 1 month, it was already up to 55, increasing up to 24 months to about 75. So there was a marked improvement in the quality of life of patients following HIFU. Again, we also fill in a symptom severity score. And if you look before treatment, they've got marked symptoms just below 60, a score of below 60, which again also steadily decreases. And at 24 months, it's down to below 20. So they have marked improvement in their symptoms. When you look at the shrinkage rate, at 1 month, we're on average seeing about a 31% shrinkage, which goes up to, at 12 months, to 73%. In terms of fertility successes, to date, we've had 16 cases. 8 patients at the moment are currently pregnant. We had 1 4-kilogram vaginal delivery, and we've had 7 term cesarean deliveries, of which 1 was twins. The problem with our patients is we have poor follow-up. The patients fall pregnant, they go to their private doctors or they go to their clinics, and very often they don't report to us. So we're not actually sure what our numbers are. This is just a gallery of some of the babies that we've had following HIFU. This is just to show you some pictures of what happens with the HIFU treatment. So if you take this patient over here, this is before treatment. There's the fibroid there. At 2 weeks, you can see the area of ablation. So there's a marked, almost that entire fibroid has been ablated. Okay, at 4.5 months, it's shrunk down to probably about a quarter of the size. And then at 10 months, there it is. So sometimes they don't disappear completely. They might land up with a tiny little fibrosed area. Here's another patient. This is before HIFU. There you can see the fibroid over there. It's 1 month after treatment. 6 months, at 12 months, fibroid not visible. Again, here's another one before treatment. There you can see the fibroid. 1 day after treatment. So here we're looking for the non-perfused volume. So you can see almost the entire fibroid has been ablated, and there's how it shrinks. At 6 months, it's down to that. 12 months, and again, at 18 months, it's a tiny little fibroid left there. And these are some of the cases that we've done. This is before HIFU. That's 1.5 months post HIFU. You can see almost the entire area ablated, 98% ablation with a 27% shrinkage rate at 1.5 months. In this patient here, that's the fibroid before treatment. That's a fibroid at 4 months, ablation rate of about 98% and a shrinkage rate of 63%. Again, this patient over here, before treatment, after treatment. So at 23 days, less than 1 month, the ablation rate 71%, shrinkage rate 8%. This patient here with multiple fibroids, there's one up there, one over here, one over here. At 2 days post HIFU, we can see marked almost the entire fibroid ablated. And in this patient over here, again, there you can see the fibroid before treatment, after treatment. So in conclusion, we found that HIFU provides us with a very safe and effective alternative in the management of symptomatic fibroids. Obviously, all patients can't be treated, but there's definitely a place for HIFU in the management of fibroids. Thank you.
The HIFU knife, applied with FUS-focused ultrasound tumor therapeutic system, allows in vitro ultrasound to enter the body and focus on the lesion, killing only the tumor without destroying any healthy tissue. It doesn't cause a wound or the loss of blood, and patients usually make a quick recovery after treatment. So how, by a few clicks of the mouse, does a doctor finish the treatment? As an example, let's see how the treatment of uterine fibroids is accomplished in 5 simple steps. Step 1. Locate the fibroids. Unlike a laparoscope, which via hands-on operation reaches and views the fibroids, the HIFU knife uses B-scan ultrasonography to find the fibroids, including those a mere 1 or 2 centimeters in diameter. Now B-scan probe starts to move from the left side of the womb. Good! The left border of the fibroid is shown. Then we record its coordinate, +30. Then move the probe to detect the fibroid's right border and record its coordinate, -20. That's how we find a 5 centimeter fibroid and determine its position. Step 2. Make a treatment plan. A computer will help us plan out how to kill a 5 centimeter fibroid. This process is like cutting a potato in slices, except that it's done via a computer. Step 3. Contrast-enhanced ultrasound. Contrast agents are injected to determine blood perfusion, to estimate the level of difficulty in treatment, and to distinguish fibroids from normal tissue for comparison with the result of post-treatment contrast-enhanced ultrasound. Step 4. Treatment. Wait a minute before pulling the trigger. We need to make sure of 4 things. The proper condition of the patient, a safe acoustic pathway for ultrasound free of intestines, a safe water level and temperature. Focus the point of the HIFU knife aimed right at the target. Done. Now we can begin the treatment. Choose an appropriate degree of treatment, i.e. degree of thermal power, and destroy the fibroid slice by slice according to the treatment plan we made in step 2. Now that the fibroid has been killed, all the patient needs is a few painkillers as well as some music and movies. And there's no need to worry about B-scan ultrasonography images because our product is equipped with both 3D magnetic resonance imaging and B-scan ultrasonography to achieve precise positioning and treatment. Step 5. Second time contrast-enhanced ultrasound. Apply the contrast agents once again and we will find that the place where the fibroid once existed is no longer highlighted, which means the fibroid has been totally eradicated. That's the end of a successful operation. Isn't it easy and lovely without all the tiring procedures? Even though curing diseases is our duty, we do deserve a pat on the back from time to time. After the operation, nurse the uterus for 2 hours by cooling it down. Then the patient can begin having water, food and moving around. She will be able to return to work in 3 days. The residual fibroid will be cleared by the immune system. The patient will be able to get pregnant 3 months after the operation. The HIFU knife means hope for patients and is an important option for doctors. To learn more about the HIFU knife training program, please follow us on our official WeChat account.